As we age, our metabolism slows down. What this means is that we are no longer able to produce the levels of energy that we once produced. And that energy is our gasoline. It enables every single organ system to function and produce more for us. So one of the components of anti-aging medicine is to really look at a person's metabolism and provide some nutritional support and building blocks to it to actually get the fires roaring again. And what that does is it actually helps us build muscle mass, helps us lose weight, helps us get better sleep, and feel much more energized than a person who's in their 6th or 7th decade of life who is not doing those things. Anti-aging medicine has many facets. One of them is the use of hormone replacement therapy to recreate youth. In people who are in their 4th, 5th, and 6th decade of life, through the process of natural selection, our hormone levels decrease. When hormone levels decrease, there is much research out there that chronic disease will set in due to the low hormone levels, because our bodies are programmed from an evolutionary standpoint that we need to be hearty and healthy in our youth so that we can reproduce and further the species. As we get older, medicine from a standpoint of anti-aging actually deselects us, and as the hormone levels go down, chronic disease sets in. So what we see in the news today are people like Suzanne Summers who are replenishing her estrogen, progesterone, and testosterone levels to levels when she was 20 or 30 years old in order to recap that youthing process and prevent chronic disease from setting in. Men, on the other hand, will replenish testosterone, they'll replenish growth hormones similar to what we saw in the news with Sylvester Stallone. And I think in moderation, those things are actually good because there is quite a bit of research out there within the confines of anti-aging medicine on how replenishing hormone levels actually halts the progression of chronic disease. Another component of anti-aging medicine is really functional, looking at what deficiencies a person has within their biochemistry and replacing nutrition and nutritional supplementation to meet those deficiencies. And what that does in essence is it increases someone's vitality and assists them in having a much better quality of life, being on top of their game, and being able to perform well into the 6th or 7th decade of their life.